on me when I get a shot. Like,
yeah, I hate needles too. Don't worry. I'm older and I still don't like needles. I've had multiple surgeries, but that is a real stressor for anyone, that the fear of needles or fear of, shots or something like that. That can cause anxiety. And that can cause your body to feel like it's in fight or flight. So anytime we're in stress mode, that's why it's so important to talk about how psychological trauma disrupts the homeostasis of both our physical body and our mental ability to focus and to process stress.
Yeah.
One thing I want to touch on is that stress is stress. The body doesn't understand it. I mean, getting attacked by a barracuda, being in a verbal argument with a loved one, or sitting in traffic late for work here. One stress is obviously important, but the brain's going to react. Those catecholamines, the adrenaline, produce cortisol, dopamine, serotonin, heart rate is going to be elevated. The same physiological response happens no matter what stress is.
Yeah, so we were super duper stressed on top of stress on top of stress on top of stress. And so you tell them that, and are they pathetic? Are they compassionate?
I remember one guy being in there. He was super nice. I don't really remember much. It's a trauma response. I blocked a lot of that.
Yeah, we suppress in order for us to be able to deal, right? We're in survival mode. So it's just like, how can I make it through this mode?
But there were so many people in there. There was an EMT, like an EMT trainee or shadow or something. And he sat in the back corner, and which at the time I was fine with, but now looking back, I'm like, why did I let myself say yes to
more stressor,
to letting all these people in the room?
Yeah, because having a lot of sort of chaos around us just adds to our nervous system stress, right? And our ability to what's called regulate, which is what you and I have talked a lot about and worked on, and recognizing, when I'm starting to feel my nervous system ramp up, how can I have some boundaries? Like, no, I don't want it to hurt it. No, I don't want extra things in here that are just going to be taxing my senses, right? Our senses are the indicators that tell our body what's going on around us. And anytime our senses are overloaded, it causes us stress. Okay, so you're in the hospital. You're going to go in for your first surgery.
I don't really remember much about my first surgery or the second one, but I think it was after the second one, I had a really traumatic experience with a couple different doctors. The nurses I had were phenomenal, and I think that nurses make the medical system. They were amazing. They were so kind. But I had someone come in and clean my wound, and she kept telling me to shut up and just trying to get me to stop moving. But I kept pulling back.
Why were you pulling back?
Just because I was so scared. I didn't want anybody to touch it. I didn't want anybody near my foot.
Right, because you had just been attacked by a barracuda on your foot. So anytime someone got close to your foot, it would bring back your nervous system. Like Tripp said, stress is stress. So now your nervous system is going, wait a minute, foot, attack, trauma. We don't want anybody to be near us.
Yeah, but I had a doctor come in and tell me after a surgery that I wasn't in pain, that I wasn't, I was faking it to get more medication. And this is like maybe 6-7 days out from the incident, like a week out. And she's going, you really shouldn't be in pain. And
so she's telling you how you should feel.
Yeah. And so, right. And so, me being a people pleaser, I was like, oh, okay. And
so are you now questioning whether you love pain? So anytime we're in pain, Alaska's like, on a scale of 1 to 10, where are you at? And you're now questioning, like, well, am I really at a 7? Am I really feeling what I'm feeling? So now we're going into invalidation. And everybody has different pain thresholds. but I always say pain is real, right? Whether we perceive it or not, a person experiencing pain feels pain. And we can't deny patients or clients their right to feel what they're feeling.
Yeah.
So now you're being denied.
Yeah. So I started like overthinking and like, am I really like in that much pain, or am I just, do I have a low pain tolerance? Am I really being a baby about this? Like just I was just second guessing myself, and then
Which adds to your stress levels. And then you have a lot of experience with it, because a lot of people, when they come to you, they're second guessing themselves, right? And then you have something that you use for pain and inflammation, that's the laser. And oftentimes you've said to me, like, wow, this person said, I didn't realize how much pain I was in until the pain started to diminish.
Until it starts to decrease, because we're highly adaptable humans. We get used to it.
Right. But now you're questioning if your pain is even real, because the doctor's telling you you're wrong. What you're telling me is wrong.
Yeah. And I started second guessing. I was like, I'm not drug seeking. I'm not trying to get more medication. Should I really be asking for
So
it?
now you feel ashamed.
So I started to feel ashamed, and every time I would press the call button to ask for more medication, I would start tearing up, and I would just sit there being like, do I really need this? Can I, would it be okay if I asked for this medication, or can I ask for it in a lower dose? I started overstimulating, overthinking everything. And that's, I guess, really when the passing out started, because I would go into such mental overdrive that my body would completely shut down.
Right. So that's kind of how you're panicking, right? The doctors could figure out why she kept passing out. They even questioned that, like, are you faking it? Is it real? And that's how your family reached out to me. And I remember the first time I met you, I could tell that you were going through, and I was like, let's not talk about it, let's draw it, because I knew that you liked art. And talk to me what it was like, because you and I talked about after being told you're faking it, not in as much pain as you're supposed to be feeling. There were several times after I started trying to figure out, why does she keep passing out? What's going on? Where we realized that when somebody was touching your foot or going near your foot, your nervous system just went, we're out. And how that was something before.
So you really helped me realize that I never left my fight or flight mode. I thought I had kind of gotten over it very quickly. My kind of trauma response is making jokes about it. So I was kind of joking about it. I was like, yeah, who gets bit by a freaking barracuda? Nemo, that's it. And I was making jokes about it, and I was kind of laughing, teasing myself about it, but I didn't realize that it was a defense mechanism for not coming out of fight or flight.
Right. You never went into the place of being able to process it all, because pain was the place, because you had to fly back to the US, because you were told to be quiet and shut up. You were told to be still. You were told that your pain wasn't real. You were told that you were faking it. So all of these things never allowed you to have space and safety. I think that's so important for listeners to understand how things can change for someone that has experienced trauma when they have a safe space to actually say, like, I could be wrong, but this is not feeling good. And this is my experience of what's happening to me, because all of us, as Trip can tell us, experience pain differently. I know you've had many clients that have the same injury in the same place, but will describe it to you differently. Is that correct?
Completely. Everybody experiences pain thresholds as well. Somebody else's 7 might be 2 or 3.
Right. And I know that happens often with people that are experiencing pain for a long time. Our ability to tolerate it becomes bigger, right? and stronger, but that doesn't mean we're not in pain. And you and I often discussed it. She's a beautiful young adult. She is very pleasing and nice. So it's hard for people to even understand, like, oh, she had this traumatic thing happen to her. Because it's not like, for example, somebody that's experiencing cancer where they're bald and you can see it. You can't see it in Bella unless, she shows you her foot. And then you're like, oh, wow, that's very real. So I want people to keep that in mind as we, have support for others if we're in a place, or when we need support, is that people don't understand. I remember we went through a sequence of neurofeedback with Bella where we just talked about, like, what were the stages that you went through, and you started off by saying suffocated, and then felt, so misunderstood. And that's something about trauma that I know firsthand, is that it is such a lonely journey. So can you talk to us about feeling alone? Because chronic pain, which you've now had chronic pain because it's been a year, is linked with depression. It's linked with inability to focus our attention, because our brain is so scattered on dealing with the pain. It's linked to higher suicide risk, substance abuse and misuse, because the pills ease the pain. So then it's easy to keep popping the pills. And so talk to us about the feeling alone, even though you have a very supportive, loving family. And I as well, supportive family, it's still lonely.
Yeah, it is very lonely. Don't you don't have anybody to relate to, and it's hard to find someone to relate to. Specifically with my instance, I don't know anybody who's gone through this, but specifically dealing with chronic pain, and after my CRPS diagnosis, it was hard to find people who really understood it, because it's such an out of body experience. You feel so it feels so hard to move. Like, I would scream and cry every time I had to go to the bathroom, because I couldn't leave my bed. I couldn't move, even though it was like in my leg and in my hip and in my foot. I felt like I could move my arm or my foot.
But you look normal. So what's the big deal, right? Because you look, quote unquote, normal. And that's where trauma-informed care, the principles of trauma-informed care that I spent a lot of time with you, is, can I feel safe, right? And that's where other people come in. Can I trust that I can be where I am? Do I feel like I can be empowered in some way? So maybe you can't move, but what are the things you can do? And that's where we went into drawing. Maybe talking about it isn't useful because it sends your system into overload again. And we're going to show this picture that Bella drew, which is the most impactful thing I've ever crossed, that shows, I mean, when I saw it, I was like, yes, that is pain. And I've even sent that drawing that Bella did to doctors that reach out to me and refer me clients. And even your referring physician. And I said, listen, this is what your patients are experiencing when we tell them you're wrong, you can't feel that, or are you faking, or why are you passing out? So I love that you did that. So let's now talk about what you said about it's an out-of-body experience. It's so misunderstood. So you try to work with so many different branches of healthcare to help you, which is what everybody should do, right? Use their resources. You should never get stuck in your circumstances, which you've beautifully done. But let's now talk about how, when people don't know and don't understand what's happening to you, oftentimes they are hindering your ability to recover. So talk to us about a really cool thing that happened where you started feeling this pain in your back, right? Because we know that back pain is one of the things that most people suffer from in the US. So you had this pain in your back, you showed it to me, and I'm like, you know what? Trip has this laser that helps with pain and inflammation. You're like, I've tried so many things, nothing's helped. So tell us about that day and how that happened.
So I had been having back problems this just about this whole time. And I was like, I don't know what it is, but it's driving me crazy. And I had a couple different doctors be like, you shouldn't be having back pain.
Yeah, that's not real. You're wrong.
Yeah. And it circles back to the whole you're not in pain thing. I'm not the only one who's ever told me that. But I came to you one day and I was like, you said something about back pain, and I was like, I have been having back pain, and all of these doctors have been telling me you're wrong. Like, you shouldn't be having back pain. That's not really there. You can have phantom pain. And I was like, this is not what that is.
Which, by the way, patients always know. We know what we feel. So that's important. Okay, so we called Trip in and I'm like, hey, you can help her. You tell her.
Yeah, so she calls Mr. Chip in, and he was like, "Oh, well, that's linked to your dermatomes," and I was like,
Well, I assume, hear yourself, well, the dermatome map.
I was like, "What the heck is a dermatome?"
What is a dermatome, Trip?
It is nerve root coming off the spine, the dorsal horn, vertebrae, breaks through the body. The peripheral edge that connects to every piece of your body. So you have one nerve and going down to your right toe, left foot, this part of your forearm. So everywhere in the body is associated with spine. So the fact was hurting perfect sense. Your foot got hurt. Very traumatic. Hit the piece off.
Mhm.
That nerve is a literal cord fiber that goes from your foot all the way up through your body, follows some path somewhere. Your vertebrae is a very specific one.
Exactly where you by the way.
Well, that cord got
Mhm.
so you feel sensation anywhere up that nerve line. It doesn't have to be where the problem. Rarely, at least in my experience, where we're problem is rarely where we feel.
So and I remember you going, oh my gosh, was it validating for you? Was that experience validating? Were you like, I'm not crazy?
It was the most validated I had felt in months. And I like got in the car and I felt this huge weight off of my shoulders because I was like, finally, like I was like, I'm not crazy.
Yeah, and my pain is real because pain is real, but when we're told we're wrong. Yeah, which is why I keep bringing this up, right, for listeners, and it's like, you're not alone. So Desiree, my wonderful intern, pulled up the statistic that up to 70% of the population will experience exposure to more psychological trauma in their lifetime than if they had never been exposed to trauma. So oftentimes being exposed to a crisis or trauma opens us up to experiencing more and more and more, like you did, like crazy, I must not be feeling it. That's traumatic to think that you're imagining things or that what you're feeling isn't real. And devastating to us emotionally, right? Because now we're doubting ourselves, we feel alone, we don't feel like we can trust ourselves and what we're perceiving. And the more we're exposed to stressful, traumatic experiences like the medical system that you described, the greater the risk of other issues coming up.
Yeah.
Which is a lot of what you and I, not letting circumstances override you to where you become the trauma, right? Or you become the circumstance. So can you tell us briefly for, the two people we know were unfortunately attacked in Florida, if you could point people in the right direction, if they are ever supporting somebody that experiences an attack like that, if you had been there, what would you have done?
I would have loved to have a calming presence that it affects everybody who sees it and it happens to. But I wish I had more of a voice of reason and a more like a stable, like goodness, I don't even know how to explain it. But
Like what we discussed with your mom, right? Like just
Mhm.
a hug. And although hugs seem so like, what's a hug gonna do? We know that when there's traumatic car accidents, when strangers hug the victim of the accident, that can help them not develop PTSD.
Yeah.
So I think what you're describing is like this safe environment where although you're still in pain, still in trauma, there's this sensation of, but I'm protected.
Yeah.
Right. Okay. So what else can you leave us with of how people that have loved ones or friends that have experienced traumatic experiences, how can they be a support to them?
Just to be an affirming voice. I had a very loving, supportive network of people, but in the beginning, I wish I had an affirming voice telling me that what I was feeling is real and what I was going through was okay, and that a lot of people say that you're not alone, but that feeling of aloneness is so
Right.
so real. It's right there. But just someone who had consistent affirmation was something I realized that would be huge.
You've had quite a journey.
Mhm.
Tell us about where you are.
I know now that I am stronger because of it. I'm at a point where I can look back and not quite be thankful for it, but kind of understand that I am stronger enough for it. I have empathy for people that I never thought I would. I may not understand the person's situation, but I know what I felt, and I know what I would have liked. So I try to instill and give that to other people when
Yeah, and when you say stronger, I watched your emotional growth be tremendous and to honor where you are, despite the fact that other people can't understand that and maybe are experiencing it differently. Because, like you said, it does affect everybody. And I also have seen how courageous you are. You know, you told me your goal is to go to college, and the odds have been against you. And I've watched you go, it's happening, it's happening, it's happening, it's happening. And all these things that we know can happen with pain, you've been like, not me. I'm not gonna. So I'm so proud of you, and I'm so grateful that I got to be a part of your journey. And I want to encourage people to really understand the importance when there's a crisis or when there's trauma of not discriminating against those people, not saying, oh, you should be able to deal with it, or oh, you should just get over it, because even though you're in a much better place and you are stronger, you don't just get over it.
Yeah.
You don't just get over it. You move through it. You learn to live with it. You learn to make it part of art, so that the next time obstacles or barriers or challenges happen, you go, hey, if I did that, I can do anything else. But it's still something you don't quite get over. So we have one more minute. What would be your advice to somebody that we did advice to someone that is supporting someone, to someone that is experiencing something like that? What's the number one thing that you think helped you the most?
To rely on what you feel. Like you said, you know what you feel. Advocate for yourself.
I love that.
I did not advocate for myself very well in the beginning, and I regret that. Advocate for yourself.
Thank you. Thank you guys for joining us. And thank you so much for being here. We will see you next week. Great job. Awesome. How do you feel? That's great. Thank you so much for the listeners for
JoCo Community Radio.